Welcome to Rook's Health. My name is Farouk Bello. I am the host of the Rook's Health podcast. In this video, I'm going to be talking about the health and care visa, which is the visa for health and care workers to come and work in the UK and gain legal and lawful employment. In this video, I'm going to be talking about what the health and care visa is, who is actually eligible for the health and care visa, because not everyone is, and what are the perks of the health and care visa, and why is it actually a lot more beneficial, and it's probably, for regards to healthcare, it's probably one of the best visas that you can have, and it will save you a lot of time and money. That's what I'm going to be going over in this video, so make sure to stay to the end to find out each of the components of the health and care visa. Okay, basically, the health and care visa is a special type of visa that allows health care professionals or medical professionals come into the UK and work in the NHS or an NHS affiliate, strong NHS affiliate, or adult social care. Now that's where it's very key. It will have to be, NHS related in most cases, if in most of the professions I'll be talking about in this video. So just keep that in mind when you're trying to apply for jobs that you really want to be going through NHS route, because that's the way the visa is kind of constructed at the moment. There are a few exceptions, when I mean NHS affiliates, but keep that in mind. Now, a little bit backstory about this visa. This visa was actually introduced towards the end of last year, if I'm not correct, August, because of the high demand of healthcare workers during the pandemic, and you had reduced supply, which saw, just quick backstory, you saw students having to come into more developed roles and filling in multiple gaps in different ways, nursing students, physiotherapy students, a lot of different healthcare students. So this visa actually was kind of promoting the use of coming to work as a medical professional to try and meet that demand for healthcare professionals during the pandemic. Now, let's quickly get into who's eligible. Now, it's a very long list of jobs that are eligible. I will leave the link below so you can go straight and find if your job is applicable. And I will also, try and let it roll towards the right here, just so you can have a look. If you can pause the video if you want to. But a lot of different healthcare professionals. You have physiotherapists, biological scientists, and that's a very interesting one. A lot of people think immediately it's healthcare professional, but biological scientists, but they have special requirements, which I will cover in a separate video. You have occupational therapists, speech and language therapists, and everyone you see on the list to the side here. But it's a very comprehensive list of the categories of people in healthcare and medical professionals that can work. So just make sure to check if the job you want to apply for actually is on that list, because if you're not on the list particularly, you're not going to be eligible for the health and care visa. Now, normally the visa can last up to about 5 years, which is very good. For people who know, years past, you would maybe get 2-year visa or 3-year visa, you would have to renew every time. However, with this visa, you can actually get a 5-year visa. You can get up to a 5-year visa, and then you would need to reapply. But after 5 years, you can probably even be eligible to apply for a permanent residency, and then you wouldn't even need to. But that's another whole topic for another day. So we'll keep it to just being aware that you can get up to a 5-year visa if you qualify under the health and care visa. Now, let us move into the perks of the visa. Now, the perks of this visa is very much beneficial. The first one is it will save you a lot of money. The biggest way it will save you money is on something called the health surcharge, which basically in past years, it was a surcharge you have to pay for every year you were going to stay in the country. So if you were going to stay for 5 years, you're going to have to pay a set amount every year to use the NHS, because as you're aware, the NHS is, you don't pay to use the NHS technically. However, with that visa, prior to the regular tier 2, you would have to pay every year you were. And that can easily rack up to thousands, even if it's 2, 3 years, 4, 5 years. If you have a 5 years, it could easily be over, thousands of pounds. That has been cancelled with this visa, so that is not even on the table anymore. That has been scrapped. The second way it will probably save you quite a bit of fees is also, it probably has a slightly reduced visa fee in itself, as opposed to the previous tier 2 visas. So that's a big one already, which will save you money. The second thing it will save you on is time. Now, in past terms, when you submit that application, technically, your application could take months. It could take a month, it could take 2 months, mine even took 3 months, but we'll leave that one aside. But you have to be aware it's the pandemic, so time frames are very varied. It's not rigid. However, on the UK government website, it says it should take around 3 weeks, which is a very short time. And if you see your visa in 3 weeks, or you get a decision in 3 weeks, now, obviously just applying for it is not the end of case. You have to get approved. And that's where it comes into place, where your decision should be get to you within 3 weeks. And that's a very good time frame, because mine I got mine in, I think, 3 months or 2 months at least. But you have to, again, it's pandemic time. There's a backlog. So if you're, depending on the time you're listening to this or watching this video, times will vary, but just be prepared to have a bit of a wait for the visa to get a decision on. Now, let's quickly talk about the salary requirement, which is actually one that is very, very interesting. Now, normally you would need to get at least, if I'm correct, which I am, at least £20,480. That's the minimum salary you can get. However, the going rate for different professions differs. And I'll put that in the link below as well to check your own profession. So it basically needs to be at the level of what your profession is. However, biological scientists and physical scientists have quite a different caveat, separate section, and they don't necessarily follow that same rule of 20,480. However, in the next videos I'll be making, I'll start breaking down some of the more specific ones. I've already quite gotten a few requests for, physiotherapists. No surprise there, I'm a physiotherapist, and biological science, which I will cover on specific videos by themselves, because each of these different codes can have their own different caveats and special things you need to consider. However, the overarching message is quite similar to all of them. But if you want me to cover specific professions, just pop in the comments or send me a message, and I don't mind, I'll make a whole video about that. I kind of have a whole good idea of each of the processes for a number of them, because again, they're similar, but they have differences, and you just need to be aware of those differences when you're making your application, so you nail it on the first time. Let's wrap up this video, but that is the basic you need to know about the visa, health and care visa, because there are loads of other things you can consider, and there are actually special segments. So there is, if you're transferring from a tier 2 to a tier 2 health and care visa, there's if you're bringing your family, the documents you need. There are loads of other things you need to consider. However, I'm just trying to keep it brief for this video, and if there are particular elements you want me to cover, and which I will also cover in the future, feel free to let me know. However, as a bonus, I have an interview with a colleague of mine who has actually gone through the tier 4 process very frequently as myself, and is actually going through the switch, basically switching from tier 2 regular general to a tier 2 health and care. And he talks about the process and some of the challenges he's faced during the whole process and some of the tips. So expect that video coming out soon after this one. But as always, my name is Farouk, and till next video, but please do subscribe and comment, like the video, and till the next video.